While we will have a formal welcome very soon, it is a moment of great pleasure for me that we have the 9th Golden Jubilee lecture of the MPA, our Suvarna Jayanthi, to be delivered by my dear friend, one-time teacher, and continuously my mentor, Dr.S.Kalyanasundaram. Sundar was my very first teacher in postgraduate psychiatry, and though Ramola will be welcoming everybody, a personal welcome to you, Sundar, for this very momentous occasion for us at MPA. Another of my teachers, Dr. Mohan Isaac, will be chairing this session. And before we go further, may I request the chair of our Academic and Public Service Committee, Rohini, to begin with the invocation by our Medico Pastoral Association residents and staff.
Showers of blessing, this is the promise of love. There shall be seas and refreshing, sent from the Savior above. Showers of blessing, showers of blessing we need. Mercy drops round us are falling, but for the showers we plead. Showers of blessing, precious reviving rain, sound of abundance of rain. Showers of blessing, showers of blessing we need. Mercy drops round us are falling, but for the showers we need. There shall be showers of blessing, send them upon us, O Lord. Grant to us now a refreshing, come and honor thy word. Showers of blessing, showers of blessing we need. Mercy drops round us are falling, but for the showers we plead.
Thank you. Thank you, councillors at MPA, for that wonderful invocation. May the blessings indeed be upon this function today. I stand here as your anchor for this afternoon, mainly on behalf of the President of the Medico Pastoral Association, Dr. Joseph George, our Secretary, Mr. Alphonse Kurian, and the Chair of our Academic, Public Service and Publications Committee, Ms. Rohini Rajiv. May I now invite our former secretary, a very dear figure to me because it's on account of her that I am associated with the MPA, Ms. Ramola Joseph, to render the formal welcome. Ramola, over to you.
Thank you, Ajit. Greetings on behalf of Medico Pastoral Association and a warm welcome to all our guests in India and all over the world. I can see there are people even from down under, especially Susie Joseph and others. We are honored that our eminent speaker for today is Dr. Kalyanasundaram, a veteran on a veteran's journey and lessons learned. Thank you, Dr. Kalyanasundaram, for generously accepting MPA's invitation to our Golden Jubilee lecture series. Today, 22nd October, is a special day as it is the birth date of MPA's late founder, Dr. Joyce Siromani. We welcome her daughter, Mrs. Anita, and Mr. Naveen who I hope is also joining us for this lecture. And we remember and acknowledge all the contributions that Dr. Joyce has done for MPA. We welcome with gratitude our sponsors and well-wishers from Micro Labs. And besides all the guests attending, we also welcome all those connected with MPA, the management, the members, volunteers, staff, residents, and friends. Of special mention, our patron, Dr. Mohan Isaac, who's waiting patiently to do the formal introduction of the speaker. Please, Mohan, give me a couple of minutes. I have to narrate a little story which is very appropriate for today. MPA started by Dr. Joyce Ceremony with her team of medical and pastoral people from St. Mark's Cathedral and took tentative steps to make MPA journey. Our first counselor, whom we see now, was Susie Joseph, and she was trained and groomed into the rehabilitation process, which was at that time a very new concept. Several years later, Richmond Fellowship came into Bangalore and they kidnapped Susie from MPA. We were all quite sad and maybe a little angry. Years later, I was surprised when Dr. Sarga Menon selected me to go and attend the WAPR conference in Hamburg, Germany. I was more surprised to find that at that time, there were no halfway homes in any country, none based in the community and none on the model of Medico Pastoral Association. In Germany, I met up with Dr. Kalyanasundaram and also Dr. Murli. Seeing there were so many countries represented and were all sharing how they were working with the mentally ill and how they were doing their rehabilitation, we decided that we should join hands and discuss things and learn from each other. And later, the Karnataka Association for the Psychosocial Rehabilitation came into being. Dr. Kalyanasundaram and his team were very supportive, and it was a great blessing for many other organizations as well. Thank you, Dr. Kalyanasundaram, and all those who were part of AAPR. I now hand over the mic back to Dr. Ajit Pillai.
Thank you, Ramola, for that very warm introduction and the personal touch of your association with so many stalwarts. Not that you are any less of a stalwart yourself. We will now proceed to the lecture, for which may I invite my teacher and friend, and as Ramola mentioned, the rejuvenator, patron, and past vice president of MPA, Professor Mohan Isaac, who has joined us from Perth to take over. Dr. Mohan Isaac will introduce the MPA as well as our speaker for this evening and chair this evening's proceedings. Over to you, Mohan.
Thank you very much. Thank you very much, Ajit. It's indeed a great pleasure to preside over today's meeting for a number of reasons. Most important of which is that today's keynote main speaker, Dr. Kalyanasundaram, my association with Dr. Kalyanasundaram, also this is the Golden Jubilee year. It is not just the MPA. I'll tell you a little more about that later on. But let me first do what Ajit asked me to do, introduce Medico Pastoral Association. Medico Pastoral Association has already been in a way introduced by Ramola. It was registered as a non-governmental organization in the field of mental health and rehabilitation in 1972. And that is why 2002 to 22, we are celebrating the Golden Jubilee. Ramola, of course, said at that time, we were the only one in the country, etc. When she went to Germany, she realized that it's not only in the country, but there are no similar halfway homes located within the community elsewhere. So it is a unique organization. Today, there are hundreds of non-governmental organizations doing number of things, very, very specific things. And, the non-governmental organization sector as a whole is contributing immensely to the mental health in the country, which government alone or other sectors alone cannot do. So some are charitable institutions, some are non-profit making institutions, various kinds of institutions. So MPA was the first, and it was registered on the 3rd of August 1970. But so this is the Golden Jubilee year. Medico Pastoral Association does a number of other things: suicide prevention, mental health care, awareness, public mental health education, numerous activities. But this 9th lecture is also very special for a number of reasons. And I just want to mention 2 other reasons. One has already been mentioned by Ramola. The date of this lecture, 22nd of October, is also the birthday of our founder, Dr. Joyce Romani. So we are delighted that it is taking place on the day that our founder was born. Usually in Medico Pastoral Association, we have introduced the Joyce Romani oration. We otherwise celebrate her birthday in the halfway home, etc. But now we are on a Golden Jubilee year program, and this is the 9th of a series of 12 lectures. 8 lectures have already been completed. They were all recorded, and every time I come to India, I hear from people. In fact, the most recent was about a month ago. A very distinguished psychiatrist of Bangalore, he said one of the things that he does when he goes for his morning walks is to listen to the NPA's Golden Jubilee series of lectures, all of which are recorded, will be available, including Dr. Sundar's lecture. Kalyanasundaram's lecture will be available. So that is the first of the important thing today. The second important thing is that, again, a unique thing which the Medico Pastoral Association has initiated, and I believe it is still the only thing in the whole world. And I'm referring to the Bangalore Rehabilitation Cricket League. I'm saying this because in Australia, many of my friends from Perth has gone to Melbourne to watch the India-Pakistan T20. So for people from South Asia, and now I realize after listening to the T20 thing that it is not just in South Asia. Many African countries are part of the T20, Ireland, Netherlands, etc. Cricket is becoming slowly a world game. But it is probably only in Bangalore that we have a cricket league for people who are, getting rehabilitated from chronic severe mental illness. Of course, this is the brainchild of Dr. Madhukar, a cricket enthusiast, friend of MPA, psychiatrist of Bangalore. This is October is the month when we every year have, I think this is the 8th or 9th season of the Bangalore Rehabilitation Cricket League. The third reason why today is very important is October is also the month of the World Mental Health Day. Usually, Mental Health Day is celebrated every year by MPA, by many other organizations, etc. In the initial years, one of the very few organizations which used to observe Mental Health Day was Medico Pastoral Association. Now, of course, everybody knows, and October is a month we did not have a special program because we have these Golden Jubilee lectures, and we have requested our speaker, Dr. Kalyanasundaram, to besides his very, very special lecture on the topic that is his journey and the lessons learned by himself and the lessons that he can tell all of us from his life's journey and work in the field of rehabilitation. He would also briefly mention or give a message about the World Mental Health Day. So this is a very, very special, although it is the 9th lecture, it is taking place on Dr. Joyce Romani's birthday. October is a month of World Mental Health Day, and we are very proud of the BRCL, which I believe till today is the only such activity in the field of rehabilitation for mentally ill people anywhere in the world. It is of great relevance because even very not amotivated, but less motivated people, at least I know from Medico Pastoral Association, that they get so excited when the BRCS season starts. And recently, I could not attend this year, but I saw the photographs. Several teams from Cadabams, teams from RFS, etc., participate, and it's a great event. As eventful, as exciting as the T20 or any other cricket team. Now, today's lecture, I told you it's a very, very special lecture because not only because the speaker is Dr. Kalyanasundaram, I want to say a few things about Dr. Kalyanasundaram before I welcome him and invite him for the lecture. He joined NIMHANS in 1972. That is the year when Medico Pastoral Association was registered. I was junior to him, 1 or 2 years junior to him, but I knew him before because I was intending to do psychiatry. And I used to, meet people who are bright students in NIMHANS doing their first year MD, etc., to see whether this is in fact the branch that you would like to join. So I used to know Sundar even before I joined. I joined in 1974, but Sundar was already there in NIMHANS. He is a very distinguished leading psychiatrist. His detailed biodata is around, but after I say a few more things, I would request Rohini, if at all she can, without disturbing the proceedings, put on the slide. But if you can't, doesn't matter, because that might distract people, because that has a busy slide with a lot of information. But I will give you the highlights of that. He passed MD from NIMHANS and then joined the faculty of NIMHANS, worked as a lecturer in psychiatry when we were colleagues in the newly started community mental health unit. We were colleagues, and then several years later, Dr. Kalyanasundaram left NIMHANS and he went into private practice. But that is only part of the story. He became the chief CEO of the Richmond Fellowship India, Bangalore. It started in Bangalore. It became Richmond Fellowship India much later. And he held that position with great distinction for 30 years. And he continues there in the Richmond Fellowship Society of Bangalore as the honorary advisor. And one of the very unique things which the Richmond Fellowship did, which again, I can't think of similar examples anywhere else, either in the country or anywhere in the world. Dr. Kalyanasundaram was singularly responsible for starting the Richmond Fellowship postgraduate college of rehabilitation. We know about various kinds of postgraduate colleges and all that, but a postgraduate course in psychosocial rehabilitation, and Dr. Sundar was singularly responsible for getting all the accreditation from the university recognition, etc., etc. So he has a long experience. He has published about rehabilitation. He has also been a mentor, a teacher. And the last thing I want to say, I'm sure he will be pleased to hear that he's also a golfer. He's a very keen golfer, which I think he still loves playing and all that. My only regret has been that since I'm not in Bangalore, I don't get to meet him so often. But thanks to Zoom and thanks to these kinds of occasions, I can see him. So Sundar is the distinguished speaker. He is going to talk to us about mental health, the veteran's journey and lessons learned. Before I invite him, I want to also recognize that this lecture is attended by a lot of people. In fact, I do not want to mention all the names, but there is a possibility of missing out on names, but I cannot but help but mention several people. Ashok Rajan has already been mentioned. He is a student, alumni of NIMHANS. He is a psychiatrist in Canada. Susie, our first counselor in Medico Pastoral Association, picked up. Susie has written about how she decided to work for MPA. She was a new psychology graduate. She could have done anything at that time, but she joined MPA because she wanted to work with the Medico Pastoral Association. As Ramola said, I have no complaints about Susie being stolen by Richmond Fellowship because she contributed to Richmond Fellowship. I would also believe that Richmond Fellowship was what it was because also Susie's contribution. I note Jumma, who is from Paripurnata, which is the other organization in Calcutta, which Dr. Shiromani started. I see Dr. Shivakumar, who is the head of the Department of Rehabilitation, or I don't know whether he is head of the department, but he is the chief rehabilitation psychiatrist at NIMHANS. Lata Hemchand, also of Richmond Fellowship, Ali Khauja of the Banjara Academy, and numerous other people. Sundar, this is just an indication of how people are eagerly looking forward to listen to you. I don't want to take away any more time. Ladies and gentlemen, please welcome Dr. Kalyanasundaram for this 9th Golden Jubilee lecture. Sundar to you.
Thank you. Can I share screen, please? Can I start sharing?
Yes, please.
Sure. Can I see?
Yes.
All right. Thank you very much, MPA, the office bearers. Can you hear me?
Yes.
Yeah. Office bearers and friends. I'm delighted to be part of this evening's proceedings. I was going to mention the same thing. MPA and I in the same profession for 5 decades. It's been a singular honor to have been part of MPA meetings in the early 70s. And I was someone who learned a lot from the very presence of Dr. Joyce Romani. You sit next to her, you be with her, you don't have to hear anything, but that lady was oozing compassion and care. And that, I think, was something that stuck with me. And Ramola, thank you very much for the introduction. Just a small change. It was not an objection, it's poaching. We did poach Susie, and what she did to MPA, she did to her. Susie, just to acknowledge you here, today, the TC programs we run, we owe you a lot for what you started with us. And when I sent a message to her, she said she already received from MPA. I'm delighted to see Susie. Susie worked with us for several years. She wanted to go to Australia. We encouraged her to do that. And there she is. We have spent quite a few days with her. Every time I want to go to Melbourne, that's the place I stay. What do I say about Mohan and Ajit? Two of my dear friends and colleagues. Need I say more? I'm delighted to have you. Now, this talk is all about my journey of 5 decades in mental health and not necessarily in rehab. Now, the topic is good. The presentation is going to go like this. You can read it for yourself. I've taken one case example from each decade of my 5 decades of experience in mental health. And more importantly, each of the stories is something I've learned from. And I don't know how to read it. You can read it. Decade 1 up to decade 5. And of course, the last will be a brief note about Richmond Fellowship and what I have been with them. Let me start with why psychiatry. Somebody in the background, please. Can we get the mic off? Gentlemen, ladies. Can somebody put that off, please? Yeah. So when I was
meeting,
Please mute yourselves, everybody except Dr. Kalyanasundaram and Dr. Mohan Isaac. Please mute yourself. Please.
Sir, whoever is the admin can do that. The admin can select participants and select as all mute.
and the admin
Everyone will be muted.
Everybody, please.
Ganesh or Rohini, could you please do that?
Yes, sir, just doing that.
Thank you.
Yeah.
Can you hear me now?
Yeah.
So around the final year of MBBS or beginning of internship, my mother, whose father was a very well-known cardiologist of those days, he died very early in Madras Medical College, and her brother, was a well-known neurologist, Dr. K.S. Mani, my uncle. I was telling her that she was asking me, what are you planning to do? I said, I may take up psychiatry. She said, why psychiatry? He said, why not neurology or cardiology? The very popular and a very in thing to specialize in those days. And I said, why not psychiatry? And that is how, and I ended up being in psychiatry, not because I said that to her, but I'm starting to tell you how it happened. I was a house surgeon in the 1970s. My classmate, Ashok Rajan, an MBBS classmate, thanks Ashok joining from Canada. I was asked to look after a life convict who was awarded a death sentence for murdering his wife. So my chief said, I want you to go and see him because he has severe asthma and we need to give him IV aminophylline. One of my colleagues here will understand. Slow IV of aminophylline to be given. And I went to see him first time. For obvious reasons, I was very nervous. Outside the room was a policeman with a very reassuring looking huge gun, the rifle. I did not know whether it worked or not, but it gave me a lot of confidence for him to be around. I was ushered into the room. He was sitting there. I asked him what his name was. His name was Kalyanasundaram. So I used to go repeatedly because he would have a wheezing every night. And I was asked to go and he would sit and talk to me while I was injecting the aminophylline IV very, very slowly. I would listen to his story. I simply listened. He kept talking in a very soothing tone and he told me his life story. I was completely flabbergasted. Here the man was been awarded a death sentence because he decapitated his wife and her lover when he saw them in a compromising situation when he came home from the fields. He accepted inevitability and I was simply amazed by his attitude. I realized over the months I used to meet him, even when I was not on duty, he would ask the duty nurse to ask for me. Even though I did not, was not on duty, I would go and meet him. I realized it is easy to judge people, but in life, there are other perspectives, something which he taught me. He was full of compassion, calmness, took responsibility for his action. He was philosophical. He accepted his fate, as he would call it, or accepted what he was given as a death sentence. It opened my eyes. I used to think about him a lot. I used to think about what he spoke to me about. I used to think about what he narrated to me about his life, about being a child, growing up, his family, his little field that he was growing, small amount of rice and whatever else he was growing, and his family and his children. I got to know his family like my own family. This went on for months. Then I was posted out of the unit. But much later, even after I left the unit, I would continue to meet him for those 12 months in housemanship. He wrote letters to me after I left Madurai, and we continued to correspond. This interest kindled my association, my appreciation of human beings, their mind, their way of thinking, and probably this was one of the reasons why I took up psychiatry. This is decade 1. The topic is Fools Rush In Where Angels Fear to Tread. This was an demand of the consultant that day in the crowded OPD. A resident informed me that a patient has refused to get out of the car. He was sitting inside the car. He said, sir, we went and called him. He refused to come. The relatives are flabbergasted. They don't know how to get him to the outpatient department. So I walked out with a great amount of confidence. And it was an ambassador car. I saw a bearded youth. in his mid-20s or early 30s, sitting on the right side of the corner of the ambassador car. He was staring at the floor and did not look up. I went to his side, knocked on the window. Windows were raised, all 4 windows were raised. Knocked on the door, knocked on the window. He didn't budge, he didn't stir. So I went to the other side, opened the back seat, and sat on the left side of the car. Only 2 of us sitting in the car, there was no one else. I said, hello. He didn't move a muscle. I tried to ask him what was his name. Where is he from? No response. After much time that has passed, several minutes later, he gazed at my eyes, put his hand inside his jeans pocket, and extracted a sharp knife from his pocket. Ladies and gentlemen, you need to see the scenario. I was all of 22, and here I was. I was not 22. I was early 20s. I'm sitting trapped inside the car of someone whom I do not know. He has taken a knife. It was long and sharp, and he started polishing the knife on his thigh. His eyes were fixed over my eyes. I was uneasy, but I did not try to show it. I tried to be calm. I knew that I did not want to make any sudden movement or a gesture, because any movement or a gesture, obviously a paranoid individual, he may think I may come to attack him. But if a simple, thin, puny guy was a well-built fellow, there's no question of me attacking him at any point in time, but you never know how they will perceive it. And I thought any sudden movement, he might pounce on me, and he had a knife in his hand. What seemed eons, I slowly extended my hand and said, will you give it to me? Not knowing what he will do. Whether he will give the knife to me or he will stab me with his knife. My thoughts were running wild. My mouth was dry. I held my breath. I could hear my heartbeat. But after a long time, he handed the knife over to me. I took it. And once I was trapped inside, I was hesitant even to get out of the car, because any movement of my hand going towards the handle inside could have distracted him, or he could have done something. I opened the car, slowly got out, my heart thumping, got around, opened the other side of the car, and extended my hand. He looked at me, put his hand on my hand, and we came out. By then, the residents and all were waiting to see whether I have to go to an emergency, whether I'm bleeding. They were heaving a sigh of relief. And I indicated, go to the canteen and wait. I took him to the canteen. We had a cup of tea. After having a cup of tea, I put my hand on his shoulder. I slowly walked towards, by then, the residents had informed the closed ward, male closed ward, and said, so-and-so is being brought for admission. I went there, slowly he was taken inside. I came out, heaved a sigh of relief. Now, what is the lesson there? Sometimes in a psychiatric profession, one can be very confident, one can show bravado without assessing the person or the scenario. I simply walked in without realizing the consequences, what could have been. So the lesson is, bravado can be injurious to health and sometimes to life. But I must add here, in all my 50 years in psychiatry, there was only one patient who actually hit me. Very rarely you get assaulted by patient, no matter how violent they could be, you can talk them down. There was one patient who did it because he was what we call organic psychosis, post-epileptic psychosis. I was trying to examine his fundus. He just whacked me on the back of my head. I literally saw stars. So my lesson I learned here is you can be bravados, but you have to be very cautious to assess the scenario. Never did I do it. Always told my students, be careful about such scenarios. The second, one story from the decade 2 is what I call a midnight marriage. It was past midnight. I was sleeping. The dogs were barking furiously near my gate. I could hear the dogs bark. I was disturbed with the noise. I woke up. I came out and looked up from the first floor where I was sleeping. Dark there. As usual, street lights were not working. I saw two men standing near a car. Again, an ambassador, because you didn't have many cars those days. It was either a Fiat or an ambassador. I said, who is that? One of them popped out and raised his hand and said, doctor, please, it's my sister's marriage. Please come. My immediate response at that time was, no, I'm not coming now. He said, please, I didn't say anything. He said, please, will you please come? Our life, our reputation, everything hinges. Please come, my sister's marriage. Something is not all right there. So I changed. I told Usha, my wife's sleeping next to them, I'm going. Where are you going? I'll come and tell you later. Obviously, she was scared that I was going somewhere in the middle of the night with strangers. But I went down and got into the car and recognized one of them as a brother of the patient I had been treating for bipolar affective disorder. And as I was driving toward the Kalyana Mandap, I realized that this lady had stopped medication prior to the wedding. Of course, I did not know she was going to get married. As usual, they did not inform you, nor did they take permission. And please, she's behaving very irrationally. The whole wedding hall is chaotic, and there's a lot of problem that we are facing. You have to come and save us. I did not know what I was going to do to save. I had no plans, but I walked in. The mood was somber. And as you know, in the wedding hall those days, people would be playing cards, somebody would be lying down, somebody was running around in the kitchen, some things are getting prepared. By the time I reached about 1:30 in the night, I went into the room where this lady was there. Her family was sitting there. She was a hypomanic. She said, hi, doc. How are you? She greeted me, cheered up, got up, trying to run towards me. The family members were aghast. I realized, I asked them, did you give her tablets? They had some tablets. I got the tablets. I got the water. I made her swallow. She said, I won't take tablets. I said, no, you have to take. I remember giving some, I think some medication she was on, haloperidol or chlorpromazine. And then I was taken to meet the bridegroom and the parents. The parents were elderly, very orthodox Madhava Brahmin family. The parents refused to see me. He said, who are you? You are the doctor. We don't want this marriage. We want the marriage to stop. In the corner was a young man sitting there. He got up and said, doctor, are you the doctor? I said, yes. Can I ask you a question? Will she get well? I said, yes, provided she takes the medication. He turned around his parents and said, I'm getting married. I gave the word and I will stand by it. The relatives were stunned. They were very annoyed with him. The parents did not know what to say. He told them, whether you come or not, tomorrow morning at the Muhurtam, I will be there. They did not know what to say. I have marveled. Of course, the marriage went off very well. And parents did attend the wedding reluctantly. They did not speak to him for next 3 to 6 months. I have always marveled over the years, this gentleman's commitment. He said he had not known this woman well prior to the marriage, a very orthodox arranged marriage. He told me, doctor, I have given my word that I will marry. Just because she is unwell, I'm not going to give up. This was 1988. And they still live happily ever after. They continue to meet me regularly. She's well controlled on medication. He said, She will get well with the medication and she continues to be well. The third story is a little closer to my home. We have 4 brothers and 1 sister. My youngest sister, 9 years younger, after 4 boys. This illness spares no one. Fun-loving and carefree. At age 16, my mother passed away. Mohan might recollect, she was there at the time in Nimans. She was all of 46, died of a brain tumor. At age 19, she marries her cousin, our second cousin, and a year later, on February 13th, 1978, she delivered a baby girl. And this happened in Neyveli, where my father was working. I was in Bangalore as a faculty member at that time, 1978. I was assistant professor. My father called and said, Lata is not all right. So I drove down. My colleague and a senior colleague and my teacher, my senior colleague and head of the department at that time, Professor Kapoor. I never forget the generosity. He said, how will I go? He said, take my car and go. So I borrowed his ambassador car. I did not have a car at that time. I borrowed his car and drove down to Neyveli. I went and saw her. I knew severe postpartum psychosis. Her carefree life was completely shattered. I kept thinking, do we have a family history? There was absolutely no family history. Outgoing, extroverted, everything that we thought was not a signal or a trigger point for a psychotic disease, except delivery. Brought her to Nimans for treatment, admitted her straight into the hospital. Postpartum psychosis was diagnosed, treated by my senior colleague, Dr. Kapoor, and the members of our team. I was in the same unit at that time. She responded well. Later, surprisingly, she had clear episodes of mania and depression. The next 4 years, the diagnosis was BPD. I was by then a bit relieved, thinking that BPD was used to call manic depressive psychosis, probably a better outcome, and this is not schizophrenia. Lo and behold, 4 years later, my father dies of an MI. Following that, there has been a dramatic deterioration in her life. Symptoms worsened, so she repeatedly had to be brought. She used to live in a place called Aravangadu, which is an estate area where my brother-in-law had an estate. And it is about 6 to 7 kilometers from the town Kunnur. There was no treatment options there. They would give medication, whatever was prescribed at Nimans. And I remember when Professor Neki came for an examination and Dr. N.N. Vig came for examination, Dr. Kapoor would discuss this case with them just to see whether there were any other options. My senior colleagues here, Mohan, Ajit, Srinivas Murthy and several others who are here, Ashok Rajan and others will know that we had only chlorpromazine, haloperidol, trifluoperazine, not much to talk about. So she was tried on everything after discussion. And when symptoms got worsened, she had to be given ECTs, hospitalized in ECTs. I personally have given ECTs to herself several times. I remember once, my brother's wedding was there in Coimbatore. She came to attend the wedding, had a massive psychotic episode. I hardly attended every day, every now and then. I will take her to my friend's nursing home, give her ECT and come back. She would respond for a while and not recover completely. She used to stay in my house. At the same time, my wife's brother was a brilliant young man who started doing DPM, quit because he had a paranoid psychosis. There was a time when both of us were in my house. Lata, my sister, had a schizophrenic episodes repeatedly. My brother-in-law had delusions, which included me. So sometimes I would wonder, coming back from hospital, my clinic, by then I started practice, going to Richmond Fellowship, looking at rehab, coming home, looking at patients. I was coming and going like a revolving door, day after day, looking after patients 24/7. I realized caregiving is tough. All your theories about managing patients at home, do this, do that, do for them this, everything flies out of the window. At that time, I remember on one of the meetings, one of the family members was talking and we were all in the audience. She said, generally to the doctor population there, you have no idea what caregiving is all about. I got up and said, I have an idea and more than an idea. Because I'm not only a professional, I have roles of caregiving. I don't want to talk more about what all she did. Suffice is to say, she became continuously deteriorating. She regressed to a very bad degree. She was doubly incontinent. My brother-in-law, soft and gentle soul that he was, would carry her literally every day because she would be wearing nightie and pass urine in motion. He will take her out, give her a bath and bring back, only for this to be repeated twice a day at least. She would talk gibberish, infantile behavior. And for those of you who will like to know, clozapine came into Bangalore 1995 when I first imported the clozapine for my first patient from Europe. And he's still on clozapine, doing well. But unfortunately, for my sister, clozapine was not available. I used to think I've treated several thousands of patients. All the family members, all of them have come and thanked me. Here she was, I could do nothing for her. So one day I went to visit her and she was holding a sewing needle book. My mother was a good seamstress. She held a needle and she was trying to sew into the book as if she was doing it on a cloth, and suddenly giggling and laughing. She looked at me and said, Anna, Vanditya, have you come? And that was the last time she spoke to me. A few months later, the last day, a woman who, in fact, some of us would know, there was a patient called Rosemary in the man's chronic ward. And Lata resembled Rosemary. I did not have photographs at the time, mobile at the time. Had I known at that point in time, I would have shown you the before and after story. But last day, the day she died, out of the blue, she started talking sense. She called her mother-in-law and said, can you get me this particular item for dinner today, 9 p.m. And she had not spoken one sensible sentence for several months. Our mother-in-law was delighted. She was a distant aunt of mine. She went and brought. She said, will you feed me? And she fed her. She said, can I lie down on your lap? And that was the end. Around the same time, my brother-in-law was running a tea factory in a tea estate. Come back from Kunnur. He was in Kunnur at that time. Around 9:30, sitting there waiting to drive up to the estate, which would take about 30-40 minutes in the night. Suddenly he felt very uneasy. He started feeling that something was not all right. This is what Lata was at the time of her wedding. She felt something was not all right. So he kept thinking that he was compelled to keep chanting some mantra, some Ram Nam, some prayer. He did not know why. He was uneasy. He kept chanting and chanting and chanting. Phones would not work repeatedly. He tried calling, thinking something may have happened, but by the time he reached, it was all over. What happened next? Next to my cousin's house, where in Kunnur, another cousin, my brother-in-law's brother, he had a house. Next to that was a tenant. In the tenant was a 14-year-old boy. This boy used to call my sister Lata Akka. Next morning, he wakes up around 8 o'clock, runs up to my other cousin's house and said, Anna, Akka nalla irukangala, meaning, is Akka all right? He said, why? Because at that time, he had no idea what had happened. He said, why? He said, I don't know. I was sleeping. It may be around 12:30. I felt somebody touching me and waking me up. And I opened my eyes. I saw Akka standing there and said, now poitu vara, meaning, I'm going. He thought it was strange. He wanted to know whether she was all right. He was told that she passed away the previous night. Can science explain? Can I explain? What is this phenomena? I do not know. But here it is for you to see what happened. This is the story of this young lady who passed away at the age of 37, and her daughter lives in Bangalore. That is my niece with her 2 children. Next one, I call this eating humble pie. This is decade 4. I've treated several members of this particular woman's family, at least 3 sisters and 1 brother, psychosis, organic psychosis, dementia, and schizophrenia. This lady, currently 55, she had protracted mild symptoms of schizophrenia for nearly 30 years, on good control on medication. She had a son after much delay. She was extremely attached to that only single child. And bright young boy, she would come and bring him periodically from the time he was born, and I've seen him grow pretty well. He was in college. On his 19th birthday, the night before, he came and told his mother, I feel like lying down next to you tonight. She said, why? I don't know. He used to sleep in another room, but I want to lie down next to you. She said, hey, Mari, 19 years agide yake illi malkoltiya. You are 19 years old. Why do you want to come and lie down next to me? No, Mama, I want to sleep next to you. He slept there. Next morning, he took a bike because he was going with his friends for a ride, and that proved fatal. He died in an accident. She was completely devastated, obviously, came back and cried, and she said, there is no God. I've been praying this, that. Why should he go to the temple? Why is there a God? How can that God torture me? How can he give me a son? How can he be a good son and take him away like this? I had no answers. I just could not open my mouth. What do you say? I let her ventilate. After a period of time, I also saw her frequently, as much as possible, counseled her, put her on some antidepressants, and tried to reassure. What can you do to reassure a woman who lost his only son? She came to terms. She came here 1 year later. She said, I made up my mind to have another child. She was by then 47. I said, how? This age? Do you think it's going to be easy? No, I will have a child. I said, all right, you want to have a child? Let me caution you. There are a lot of risks involved because of age factor. And even if you conceive, which may be very, very difficult, the child may have some problems. He said, no, I'm going to go for it. Are you going to support me or not? Are you going to wish me luck or not? I said, whatever happens, I will wish you. And you may have a breakdown because postpartum psychosis is common for a person with schizophrenia already. She said, whatever it is, will you look after me if I fall ill? I said, that I will. She went ahead with it. Remember, at age 35, after the first son was born, she had a family planning surgery. She had a menopause at 40, but she wanted IVF at the age of 48. Think this down. At 48, there are slim chances of her conceiving. She went to the gynecologist. Gynecologist spoke to me and said, can you do something to this girl? Because she's coming and pestering me for IVF. I said, I've tried my best. She wants to do it, and she conceived. And the doctor told her, you will not be able to feed her. And believe it or not, she did secrete milk and fed the boy for 18 months. I was flabbergasted. Tenacity, never say die attitude, enormous faith, resilience, self-confidence, persistence, despite illness. Amazing person. She defied all the odds, and the boy is now 7-year-old, delightful young kid. She comes and visits me every now and then. for consultation, continuing her medication, and brings a child and said, you see this grandson of yours? This is your second grandson. One went away, but I got one more for you. I was very humble. I was jubilant at her success, overjoyed. And I said, at some level, we professionals have to accept our limitations because science can only tell you this much, experience is very different. Last one, it may be some kind of a, may cause disturbance to some, you have been warned. I call this, is this rehab? We are all in rehab. But I want to talk about some people who call rehab centers and what they do. I had first seen this father of this boy, a medical doctor. He was treated by me for over 30 years. He had practiced in UK as a specialist, and he had his first breakdown in UK. And then he had a CABG in United Kingdom. There in UK, they said lithium will not be advisable, lithium will not be given. Because those days we believe lithium can be risky for the heart, especially after coronary bypass surgery with complications. He came back, he had another breakdown while in India. Some of his doctor friends whom I've known, they brought him here. I tried him on other medication, nothing helped. I said, I will take a chance and give him lithium. And I did. He did remarkably well. Remained symptom-free for nearly 30 years with me. And unfortunately, he had another CABG in Bangalore. At that time, I discontinued lithium temporarily for 1 week. He went into severe mania. It is unbelievable symptom. If I tell you, some of you would be completely flabbergasted. I wish not to say the kind of things he did during his manic phase. Absolutely unbelievable behavior. I said, enough is enough. Several doctor friends came and said, please put him back on lithium. I did it, responded very well. But unfortunately, 2 years later, he died. We are coming to the next generation. A 40-year-old son of his now, very well qualified, brilliant guy with academics, both IT and finance, held big jobs in UK and in Bangalore. He came to Bangalore in 2012. They saw me because the father brought him because he was in a manic phase. Later, we had depression, clearly second generation bipolar affective disorder. Unfortunately, the father was completely adherent. This son was non-adherent. He would discontinue medication, go into severe manic episode. Gone through several treatment options with several specialists in Bangalore. About 3 months ago, this is decade 5 in this decade. About 3 months ago, he lived alone in his own apartment. They have an apartment, and chaotic living, messed up house, did not take medication, did not eat properly, behaving very irrationally. And the neighbors were very unhappy with him. And they got together, called the police on their own. No doctor was involved in this, and admitted him to a so-called rehab facility. The mother was not allowed to meet the son. She called and said, please give him lithium that used to help him. They said, we know what we are giving. We are giving native medication. This is not any rehab centers that those of us who are sitting here and listening would have heard of. Let me first make that point very clear. One day, mother called after a long gap and said, doctor, this is what is happening. My son is admitted there. I don't know what to do. They are not treating him well. Will you do something to help me? What shall I do? I said, what is his status? She described, looked like again, another manic episode. I said, okay, he needs in my clinic. I have not admitted for anybody over 30 years, but I said, either you admit in a private place, I recommend, or best would be Niman's. So mother said, I want the boy to be taken to Nimads. They said, no, we will not release him. She begged and pleaded. You don't come, we will bring him to Nimads. So the mother waited from morning till night, waiting, looking at every car, every ambulance, every vehicle to see whether the son will come. Son did not come. They got a call and said, mother got a call and said, okay, you are releasing your son in 3 days, but our plan was for 3 months. So for us to release your son, we have to pay a penalty. If you don't pay a penalty, we will not release him. They haggled and made the mother cough up 50,000 rupees. This is 2022, ladies and gentlemen, to get her son released. He was released after paying the money, and those, what I call them, thugs, disappeared, and he was taken into Nimads, admitted, treated. Obviously, on medication, he got better. But on admission, the mother saw the manner of treatment there was severe beating, physical beating, marks of beating on his back. My question is, whose life is this anyway? What are we talking about in 2022? Treating people for mental illness. These are my questions. I do not have answers. We know there are very well-run rehab centers. MPA is a classic example, which I call mother of all rehab centers in this country. Our elder brother, sister, what you call it. We have learned a lot from MPA and their very well-run rehab center, Compassion and Care. But at the same time, there are many more self-styled centers. Who sanctions license? Who monitors? Isn't there not a collective deafening silence? How do they flourish? Where is human rights? Impotent anger and helplessness from us. What's our role? Where does Mental Health Care Act come in such situations? For this kind of an example, I'm sure many of you professionals would have seen in your own professional career some similar stories. Some time ago, our colleague Mahesh Gowda sent a link to the e-group about something similar. I think we need to stand up and be counted. I do not have answers to these questions. Okay, rehab is something I've been involved in more than 34 years. Quickly tell you about my association with the Richmond Fellowship. I've given talks on various topics in mental health and psychiatry. This is the first time I'm talking about my personal journey there, which I wanted to be something different. But it cannot be complete without my involvement with rehabilitation. Phone call in 1998, I was in private practice. A call came from my teacher, Dr. Narayan Reddy, who was my director, medical superintendent and later director. He said, come and see me tomorrow. I came, I saw, and I was conquered. I was introduced to Richmond Fellowship. 34 years and counting. I did not know what Richmond or what fellowship was. Only fellowship I knew was a different fellowship in the evening. I did not know what psychiatric rehabilitation was. Much less exposure. Then I learned about rehabilitation, on the job learning and training and imbibing and being part of me. Today, I eat, sleep, dream rehabilitation and Richmond Fellowship and similar. Today, there's a national board in Bangalore, branches in Bangalore, Greater Noida, Lucknow and Sirlaghatta, rural branch. It's a collective effort. Each has a role to play. To us, our centers, there is no hierarchy. It's a therapeutic community approach of everybody has a role. Everybody has an important role to play, be it a professional, be it social worker, psychiatrist, ecologist, nurse, attenders, ayas, lift man, patient, resident, community around you, and the family. Everybody has a role to play for a collective wellness. It's a process, it's a journey, and there's no end point. It's an ongoing journey. At some point in time, you get off a train stays longer, you stay static, and then you move on, and there is a jerk, but you move on. And you keep traveling. And there is no end point because it's an ongoing process. Things do not happen overnight. You know very well, those who have experienced in rehab, they will know this. Staff burnout, patience and persistence. Care, patience, persistence and passion. Care, compassion and competence. These are the hallmarks of rehabilitation. You can say this for all of your medical profession, medical specialties, including psychiatry in the general sense. But to me, this is the central theme and central point of rehabilitation. And I strongly believe you need to take ownership. If you need to take ownership, by which I mean, unless you take ownership of what you do, you cannot be effective. To me, rehab is not a 9-to-5 job like an office. There is something that happens all the time. You don't have to be there physically, but you may be there emotionally when required. I've been fortunate with Richmond Fellowship, being with them for 34 years, going there every single working day, sometimes non-working day, to attend to emergencies. And I've been enriched because of my association and richness from them. Now, this is one of my favorite stories. I'm going to end up with this. Some years ago, I went to Kenya on request of a family member to see some patient there, Nairobi, where I was talking to the patient's mother. Patient had schizophrenia. Long story, on treatment, he's got better. So the family thinks I've done a miracle. I didn't do any miracle. I only put him on the right kind of medication, treatment, long-acting injectables. So we were having lunch. She said, I want to tell you something. I want to tell you a story. I want to tell you a story of my friend, a doctor friend. And this doctor friend had a classmate and they were together. And this is what happened, she said. As she was telling, I was having lunch. I choked. I couldn't eat. I asked the waiter, can I borrow a napkin and a pen? I asked her permission, can I write it down? What you're saying? Because to me, this is the core of the disease schizophrenia. I wrote it down. I took her permission to use this for my teaching purpose. Here you go. Sorry. I did not ask to be sick. The doctor, colleague of his, was working in Saudi Arabia, narrated the story to his relative. She told me a story. I was stunned. This is the core. They don't want to be sick. They don't ask to be sick. They don't invite sickness. But yet, there they are. We need to understand this is what it is. He said, what happened was when the boy was admitted into the asylum, the father felt so ashamed to be in the community, he moved away to Zambia. Mother did not want to leave, but she had no option. The boy was incarcerated for no fault of his, and still happens. I dedicate this talk to all those mentioned here and their families. These are my real heroes and teachers, from whom I have learned plenty. There are thousands more out there from whom I continuously learn. They often go acknowledged. And I want to say, for over 50+ years, I want to say a big thanks to them all. And this is what I want to say to all of them. I was also asked by Roshni and Ajit that any message for mental health, because it is mental health week, mental health month. I just want to say this, not anything new, but it's what occurred to me. Mental health is too big a matter to be left to the professionals alone. All stakeholders, mental health workers, families, clients, the community need to work in unison. As we read recently, if we are not proactive, we do not work proactively at it, a pandemic about mental issues, mental health issues, mental illness issues is not far away. Let us begin now. Let us join hands. Thank you very much for listening. Happy Deepavali to you all. Thank you once again. Thank you, MPA. Thank you, Mohan. Thank you, Ajit. And thanks all of you who have come here to listen to me. God bless you all. Thanks.
Thank you. Thank you very much, Sundar, for that very, very thought-provoking and great lecture of the learnings from your life. I'm sure there'll be many people who may want to make comments or ask questions, because it has been your life's journey and it's been full of very, very interesting learnings. We may not have a lot of time because, it's the evening and it's a Saturday, but I would still like to open up for discussion. There have been lots of comments coming in the chat box, which are not really questions, but comments and feedback about your lecture. There is somebody who has written, Sundar, I prostrate myself before you. Somebody else has written, it's been a privilege to listen to such an icon of a person. Masterly journey. Numerous feedback in the chat box, but I would briefly open the session for any discussion. What I would suggest is, I'm sure many people may want to tell their stories because they would have been inspired by Sundar's personal disclosure and self-disclosure, which is, I believe, a very great thing. Only very secure people can do that. So the time is not for personal disclosure of stories. I mean, we should have, probably MPA will think of a half-day workshop where people can come and talk about their own stories. But today it is specific questions to Dr. Sundar. If you have any, concern about any of the points that you mentioned, be brief so that more people can ask. So I'll now open it. If you could identify yourself, either raise your hands or, ask for you to be, you can unmute yourself and ask the question. So it's open
Mohan,
for discussion.
may I answer one thing that has asked me 3-4 times? First of all, my stories are not unique in the sense all of you have stories. All of you professionals have stories. Whichever specialty you are in, you have a story to say. You have a story to say the way you tell your stories. It is not unique. I just thought I'll pick up samples so that what appealed to me. And there are several stories I have gathered. It is all here. I'm hoping to put it down in pen and paper one of these days before the gray cells start disappearing sooner than I anticipate. Several people have asked, with all this, what keeps you going? That's a very interesting question. People have asked me several times, what keeps you going? I say these 3 things. 3 things keep me going. 1, do not take work home. Do not take homework. I remember when I was young, my father used to come back as an engineer with files in his hand. He would sit and work in the night, evenings. Maybe I thought busy work. Earlier on in my professional life, I would come back thinking about the patient I saw that day, somebody distressed, somebody had a problem, some family member cried. All of it I would take in. And one thing I discussed with my wife, who is also a psychiatrist, working with yoga for several years, we decided, both being professionals, we said, we will not discuss psychiatry or mental health at home. But over a period of time, I decided, do not take work home. So no homework. 2, have a sense of humor. I believe in sense of humor. Laugh at jokes, crack jokes, enjoy jokes, laugh at yourself. I believe if you do not have a sense of humor, you are half dead. If you cannot enjoy somebody else's sense of humor, you might as well be buried. A strong remark, but that's what I think. So no homework, no and sense of humor. 3, have a hobby. Anything at all. Life is not about health, mental health, patience, recovery, goodness, success. There is life beyond your profession. Have a hobby. Pick up one early. Don't think, after my retirement, I will take a hobby. You lost it. You pick up a hobby now. Read, watch movies, Netflix, Prime, photography, watch birds, bird watching, journey, trekking. Do what you want. Do something beyond your professional life. To me, these are 3 examples. For example, I play golf. Golf is my personal psychiatrist. Once a week I go, spend 5.5 hours, and I debrief there. All 6 days of listening, I go and let out, and I go there and talk, crack jokes, make people laugh, and have fun. So these are the things I do. What makes you ticking? That's what makes you ticking. Thank you. Morgan, I'll come back to you.
Yeah. I will raise some other questions. You answered. I mean, somebody asked, is there burnout? I would say that you're not burned out. You have answered that.
I don't think I'm burnt out. You can see I'm still not burnt out.
No, I was just saying that somebody asked the question.
Okay.
2 other questions. Why is depression called a minor mental illness? Another question is, does yoga help? Pranayama in particular. Do you want to respond?
Okay. Depression is not considered minor mental illness. It is not a minor mental illness. In fact, I will tell you, I think when we were young and what I would call brash students and brasher early professionals, we would talk amongst ourselves in the hostel. Hey, if you have a mental illness, which one would you choose? Would you choose bipolar, we would call it MDP, or schizophrenia? We all would say, not schizophrenia, we'll take MDP, because MDP is easy. You have a manic episode, you have a depressive episode, you're normal. No, you're not. Today we know manic depressive or bipolar affective disorder can be as devastating. OCD can be killing. So any chronic mental illness is not easy to handle. Sir, depression is not considered major depressive disorder. It is a very serious disorder. It's a major disorder, yes. And what's the other question, Mohan?
What is the secret of your energy?
Aditya Vikram Rametra from Chandigarh. Aditya, we have discussed this before. I mean, you enjoy what you're doing. When you get up in the morning, do you feel you want to go to work because you're going to see somebody, you're going to see someone who's going to be a little better? In rehab, every little baby step is important. Every little baby step is important. I remember once we had a patient in her group. I don't know whether Susie was there at the time. This lady did not make an eye contact for 3 months in the group. She didn't make an eye contact. So our junior staff would be eager. She's not opening her eyes. She's not looking up. 4th month, she looked up. 5th month, she opened her eyes and she spoke. Can I say something? She said in the group. People were shocked. Patience. patience and perseverance. So you have to be there to understand things do not happen in a hurry. Therefore, what makes you tick? Enjoy doing what you're doing. Fruits you get once in a while, but it may not happen always. But whatever you get, you begin to enjoy what you're doing. The minute you stop enjoying, you start declining. As somebody said, are you going to retire? I said, not now. I'm going, enjoying my life as I go. But reduce your scope of work, but enjoy what you're doing for the periods you are enjoying it. Make it count.
Sundar, the other question is, does yoga help?
I don't know whether my wife is still
Yeah.
here, but I will still stick my neck out and say something in her presence because she's an expert. But I think if I get a tick off at the end of this talk, I will not inform you. There it goes. Yoga. Many people come and ask, yoga is a cure-all? No, it's not a cure-all. Can yoga cure mental illness? I don't believe it can cure mental illness. Can it help? Yes. We believe in yoga. What we call Surya Namaskar or a dynamic asanas are something that we would recommend for them to do. At certain stages, pranayama may help, but they are only add-ons. They are not in lieu of. They are not instead of your basic tenet of medication. Simply doing yoga of any practice without medication is a disaster. And can you meditate? We strongly recommend meditation is not recommended because during meditation, you might, in the process of sitting quiet and trying to, people think I'm sitting quiet because I want to stop all my thoughts. The very fact you think you're going to stop a thought is already a thought. You don't stop thoughts. So I'm going to be sitting in silence and empty my mind. God help you. You can't empty your mind. You can't even empty your cupboard. How are you going to empty your mind? You can't empty your mind. But these processes, sometimes people attempt without any judicious monitoring and help and support, then they land up in bigger trouble. So yoga can go hand in hand, but it's not a be all and end all. It is not a substitute. Thank you.
Thank you. There was another question which has been in a way answered by somebody in the chat box. The question was, do people with bipolar require love and care? And somebody in the chat box, some other participant said that not only people with bipolar, everybody needs love and care. You may want to comment on this, the question and the answer.
I think, as my teachers, Morgan will know, Dr. Mani used to say, TLC, tender loving care. Who doesn't need it? I think I needed plenty. I think it is not for only those who have an illness. We all live in a phase of life today where our mental health goes for a toss every now and then because we need our mental health to be taken care of by our near dear people. I think it's very important. So everyone needs tender loving care. Everyone needs affection. Everybody needs validation. Sometimes people think, oh, doctor, you are a mental health professional. Therefore, did a good job is not necessarily something that you want to hear. As a jolly well, I want to hear. Everybody needs validation. Everybody needs appreciation. Whether at home, you've done a good dish, you've done a good job. I played a great round of golf. Everybody needs appreciation. Let's not underestimate. Mohan, Usha says she would like to be unmuted.
Yeah, please. I was going to say that there is not only Usha, there's a popular request on the chat box to unmute. This would be the last. Usha would talk, and there would be one more question to you. Somebody has asked about TMS, so you may wish to answer that. And with that, we will wind up the questions. Usha, you're most welcome to come in. We thought that, Sundar only will get your response after he goes back home. But it is good that you have agreed to publicly respond.
I'm going to get it in public.
Kindly unmute Usha, and please, Usha, you're most welcome to make your comment.
I think, do you have to unmute her?
Usha is registered as Dharma Kirti. Please.
Dharma Kirti.
Usha, you need to unmute yourself.
Can you unmute? She's what is called technologically challenged sometimes, so she's able to unmute. Meantime, somebody else wanting to ask her, let's see.
Yeah, there is a question about the unethical standards of rehabilitation center that you narrated. Somebody says, isn't this due to the gap in services? Do you want to comment on that?
Want to talk here?
That is good. That
yeah.
is good. Usha, come and sit next to
Usha.
Sundar and come in.
Not in this. Put it on. Switch it off. Usha, come here and speak. She says. You can come here and come.
Somebody has already commented that it's a double treat. It is not just Dr. Kalyanasundaram talking, but it's also Dr. Usha.
Okay.
Hari Om Tat Sat. This is about the question that was asked whether yoga is useful. And then Sundar said something and he was talking about something else also, both are relevant. He was talking about some asanas and some pranayama being useful. But it's not the end point, he said. And he's reached some of that end point because the thing I want to say is that yoga is not a technique. It is not something you do like an asana or a pranayama or a meditation. These are training aspects to learn about your own body, your own mind, and go deeper within yourself so that you reach that point where you see that you have empathy, not sympathy. For every person who comes to you, it could be a person labeled as a patient, it could be somebody who you call normal, but everyone goes through difficulties and successes. And both can be damaging. You have too much of success and you have a lot of people appreciating you that can damage you. You have a lot of crisis difficulties that can also damage you. The point is that yoga is about learning to be equanimous, accepting yourself as you are, and in the process, accepting everyone else as they are. So you heard Kalyanasundaram talking about the patients he encountered along his journey. You heard about his reactions and responses to those people and what he has learned of it along the way. Now that is yoga. It is not the technique, it's an attitude to life. It's an attitude and a way of dealing with things until slowly something grows in you. And this is what is called the tender loving care. It's not an emotion that you just take up and put on somebody in your family because they're going into difficulty. It's not a sentiment. It is an inner power and energy that awakens in you when you get to understanding more and more of yourself by going deeper and deeper into what is called yoga, which is not a technique, it's an attitude.
Okay.
Thank you.
Thank
Sundar,
you.
yes, Sundar, one more question. This
Yeah.
will be the last question because it's already 5:30.
Yeah.
After that, I'll make few comments, my chairperson's comments, and hand over to Ajit, who is a master of ceremonies. The last question is, based on your experience of dealing with mental health problems in your family, what do you have to say about caregiver burden, care provider burden, carer burden?
Very true. Several times people have asked me, you have gone through, some of my senior colleagues will know it is not only about my sister going through mental illness, our brother-in-law going through mental illness. We have had several tragedies in our own family, sometimes very young in their lives. And yet, what makes you going? So if you get bogged down by tragedies that surmount you, you can just get dragged down the line. I remember coming back from my mother's death. The next day I was back in Nimans. They asked me, how did you come back? Your mother died yesterday. I said, yes, but I'm here because my patients are here to be seen. So it's your attitude. People come and ask me, how can it happen to you? When my son died in an accident, they came and said, how can this happen to you? I said, why can it not happen to me? It's about everybody else. So it's your question of how you take your caregiving. You provide the best that you can. And if things go beyond you, you are not responsible for it, but you've done your best. So I think the equanimity with which you approach life, and that is not the be all and end all in life. There are other aspects of life that is part of you. And that's what should make you keep going. As Musha said, it is not something they do on an event. It is something that you imbibe as a process and assimilate inside you over years. Then it comes over a period of time. That does not mean you don't go through difficult times, you don't go irritability, you don't go through tough periods. Yes, they do. But you do not allow them to bog you down. You just have to rise above that as much as you can and as long as you can.
Thank you very much. I'm sure if we had time, we could have gone on. Comments are still coming. I would now end this discussion, and I'll make few comments and then hand over to Ajit. My chairperson's comments. I would like to make three main points. I have always believed and known that all great teachers use stories to teach. This is from time immemorial. We, as a Christian, I know how Jesus taught using parables. Buddha, everywhere. And even today, in medicine teachings, the role of narration and storytelling is coming back. And Sundar was a classic example of using stories. These are not stories. These are real things from his personal life. Different decades as he grew in his profession and became more wise and more mature. Various stories which taught him lessons and lessons for all of us. I think they have been wonderful. What is a parable? What is a story? It's a simple story used to illustrate a great lesson. Of course, when you talk about the spiritual leaders, it's a spiritual lesson or a moral lesson. But for all of us in the field of rehabilitation, people involved in rehabilitating persons with chronic mental illness, I think these have been great stories and great learning. Incidentally, I must also say that some of the stories were his own personal stories. I must say that self-disclosure is a very, very powerful tool to convey message. But not all people can do. Sundar saying about his sister, what happened, about his brother-in-law, about his father, his mother, and especially, I mean, if it is a self-disclosure about a great thing, that is fine. All of us are experts in doing that. But to self-disclosure about sickness in the family, a stigmatizing problem, that requires immense courage, and indirectly it shows the internal, strength of the person. It's only a very self-assured person can make self-disclosure to a public. And of course, I mentioned that these are being recorded, which means that it is not just the 100+ people. It will be on MPA YouTube. Many, many more people will listen to you, Sundar, your talk. I'm sure Swaminathan will listen to it during his morning walks, because he did tell me that he listens to this because he cannot, because of his clinical work, attend these meetings. So that's my first point. I have always known that he was a great teacher. All those who have been his students in NIMANS and subsequently in Richmond Fellowship. In fact, in the many chats which came in the chat box, people said, "Oh, it's been a great honor to be your student." Must have been, I didn't know the name, they are not from NIMANS, it must have been from the Richmond Fellowship College. Now, the second point, which I noted with a great interest, is about the limitations of science. Limitations of, he talked about the story about what he thought, and he himself is a very, very knowledgeable, up-to-date doctor, not only psychiatry, but medicine. But then, eating humble pie, and he said it in the most appropriate manner. And also this, this science, it is not called science. It is, some people refer to it as pseudoscience. I'm referring to the several events, several instances of parapsychology, the instance of precognition, how the boy wanted to lie down with the mother and died in the accident, or the extrasensory perception, how Lata's husband came to know about it, how the little boy who knew Lata got in the dream that something had happened, and next morning he heard that she had passed on. So these are extrasensory perception. I mean, scientists and psychologists still don't accept it, but people who have experienced it believe it. It's part of life. So he not only enthralled us with all these simple stories from his life to teach us great lessons, but also, through several challenges to scientists and researchers, etc. Also, his experience of caregiving. And the third point, and which is to my mind most disturbing, and that is about the narration of what happened, is his very relevant question is his rehabilitation. Now, we very proudly say, many people, whom I know, very proudly talk about India being a signatory to the UNCRPD. UNCRPD, for those who do not know what it is the United Nations Convention for Rights of the Disabled. We are a signatory. We have a mental health act, etc., etc. I wish Dr. Chandrasekhar, who was till very recently, the secretary of the mental health committee of Karnataka, was here. Sundar has raised a very, very important question. This happens to be, he referred that this is a traditional healing center. The traditional healing was beating. They may have been doing other things also, I don't know. But also there are sort of Western rehabilitation center. They may not actually beat people, but things which are worse than beating. Here also Sundar explained about how they were extracting money. This is very, very disturbing. And I think all people, and Ramola referred to the Karnataka Association of Psychosocial Rehabilitation very proudly. But that is a group of people from Richmond Fellowship and MPA and such organizations. So this should be looked into, and I think this is something which, in fact, Sundar mentioned that we should stand up and take note of it. I want to highlight that point. And the last point before I hand over, Sundar said that, in 1996, when Dr. Narayan Reddy called him and said, talked about the Richmond Fellowship. He said he knew only about one fellowship, that is the evening fellowship. So I am now ending with my regret that we cannot have that evening fellowship today because you are in Bangalore. I am in Perth. Now, with that note, I hand this back to the Master of Ceremonies, Dr. Ajit. Once again, thank you very much. You will be formally thanked by the person who gives the vote of thanks. Back to you, Ajit.
Thank you, Dr. Mohan Isaac, and thank you very much, Sundar, for your candid, articulate, touching, at times humorous presentation. I will say this much. Sundar is one of those Dorian Gray people, not aged at all. In fact, sometimes when he's walking with the students, and we've laughed about this, they say, who's the teacher, who's the student? Because he looks eternally young. And I will say that his style of presentation is also so young. It is so invigorating and inspiring. Your story, your entire presentation and the story of your life in those multiple decades has been very inspiring. But I won't take away from our proposer of vote of thanks. Thank you, Samuel, for accepting our invitation to propose a vote of thanks. Mr. Samuel Mohan, who till recently was the Secretary of the Medico Pastoral Association, may I invite you now to formally propose a vote of thanks. Sam, if you could become visible and audible, please. We have to be that much scientific. Mr. Samuel Mohan. Sam?
Thank you all for such a wonderful reception and such kind words. I'm absolutely humbled, at the same time delighted. And to me, doing this on the platform of an MPA, 50 years of journey together, parallel at the same time joining hands, I think it's a delightful opportunity. Couldn't have been a better platform. Thanks MPA, thanks Joseph George, Mohan, Ajit, Rohini, and everybody, Ramola, all of you. I think couldn't have asked for a better platform. Thank you.
We are privileged to have you, Dr. Kalyanasundaram. Stay blessed. God bless.
Ajit, I'll go ahead.
Yes, please.
Yeah, please.
Sorry, somebody, I was unmuted. That's difficult to open it. Good evening, ladies and gentlemen. I consider it a great privilege and honor to propose a vote of thanks on this occasion. We just heard the 9th Golden Jubilee lecture of Medico Pastoral Association, which is celebrating its 50th anniversary, rendering human service to the people with mental illness. The lecture entitled Mental Health Veterans Journey and Lessons Learned by Dr. Kalyanasundaram has been very well received and deeply appreciated. A large number of audience have joined today to this lecture delivered by an eminent psychiatrist and a leading personality in psychiatric rehabilitation. The journey of so many decades have been very, very exciting. We thank you, sir, on behalf of MPA family for your illustrious delivery, and we are indeed honored and looking forward to your continued association. I also thank Dr. Mohan Isaac, the past president of MPA, for many years, who has conceived this idea of series of lecture during our 50th year celebration. Thank you for your eloquence and the brilliant moderation. I thank Dr. Ajit Bede, Vice President, for opening this program with his valuable inputs for introducing the speaker. I thank the President, the managing committee members, and all who are present for this wonderful. The invocation song by the residents and the MPA staff is deeply appreciated. Romola Joseph, for many years, for welcoming the audience. I once again thank Dr. Mohan Isaac for his rich and apt introduction of our guest speaker, Dr. Kalyanasundaram. I thank immensely the Ganeshan of Micro Labs for sponsoring this program and media support, which is greatly appreciated. We look forward to your continued support, sir. I thank Rohini for her meticulous planning for this lecture. I also thank all the MPA staff and all their involvement and support. On this occasion, I recognize the presence of Amita Nair, Siromani, and Naveen Siromani, the daughter and son of late Dr. Joy Siromani, the founder secretary, whose tireless effort has evolved the present Medico Pastoral Association. Incidentally, we are celebrating the birthday of Dr. Joy Siromani, and we fondly cherish her memories and selfless services to the Medico Pastoral Association.
I'm really privileged to be talking on Dr. Joy Siromani's birthday. I think I couldn't have asked for anything more. I mean, just a coincidence, but a delightful and lucky coincidence. I will do it again and again. What a remarkable woman she was. One of the most inspiring person I have met in this field.
If I have inadvertently left out any name, kindly pardon me. God bless you all and have a great evening and best wishes for a happy Diwali. Thank you, one and all. God bless.
Thank you, Sam. I don't think you left out any name. You've been very careful not to miss anybody. I'd like to congratulate Rohini for putting this program together quite efficiently. And I must say that sacrificing a Saturday afternoon is how we think of many a time when we're called upon on Saturday afternoon. This Saturday afternoon has truly been worthwhile. Thank you, Sundar. Dr. Mohan wants to say something.
Yeah, I just wanted to say one more thing. There was another item in the chat box which I forgot to mention before concluding. This is from somebody who is a well-known writer in the Deccan Herald and all that. I'm referring to Manika Ghosh, a former professor of psychology of Bangalore University. She says, Sundar, Dr. Kalyanasundaram, you must write a book about all these things.
I think I want to take the credit for putting that idea in Sundar's mind first. He keeps promising, but he hasn't done it.
Several people have asked me to do that. I'm hoping to start soon. As I said, before my gray cells drop off faster than what I would like them to, I should do something. It's all sitting there, but it should come out. Thank you, Ajit. Thank you, everybody. I think it shall happen soon.
So have a pleasant weekend, and thank you all for being here.
Thank you all, and thank you, everybody.
Thank you, Ganesh, for all the technical support, and we will now call this evening.
My
off.
pleasure and happy Diwali to all.
Happy Deepavali to everybody. Yes,
Happy
of course.
Diwali
Festival.
to
May we
all.
have more light and less
Thank you
noise
so
and
much.
less
Yes,
heat.
yes.
Thank you.
Have a pleasant evening. Stay blessed.
Thanks, MP. Thanks, Mohan and Ajit and everybody there. And Rohini for energizing me with her phenomenal communications. Thanks.
Thank you, sir.
Thank
My
you.
pleasure.
Bye-bye.
Bye,
Have a good
everybody.
evening. Have a good weekend and happy Diwali. Thank you.
Thank you, Alphonse, our secretary.
Pleasure to listen this evening.
Merry